Most of us assume that a sudden, debilitating joint or back injury always requires a specific traumatic accident. But the vast majority of these injuries don't start at the moment of pain. They begin weeks, months, or even years earlier through a slow biological process called microtrauma. This microscopic view of joint tissue shows how it works. Every repeated mechanical movement, whether it's typing, running, or lifting, places a tiny amount of stress on the musculoskeletal system. Over time, those repetitive cycles create microscopic tears and gradual wear on the joint. Because the human nervous system is highly adaptable, it actively masks this low-level inflammation. You go about your day feeling entirely normal, unaware that structural weaknesses are forming beneath the surface. Simply waking up without pain today does not mean your body isn't silently compounding structural damage for tomorrow. Operating under the assumption that a lack of pain equals perfect health locks us into the reactive pathway. This is the default strategy of waiting to address physical stress until that accumulated microtrauma finally forces a painful flare-up. Biologically, this forces an immediate halt. The body must abandon its normal daily functions and redirect its resources entirely into emergency injury recovery. In the real world, that biological shift takes you completely out of commission. It results in missed days at work, canceled plans, and weeks spent restricted to the couch waiting to heal. This split-axis graph shows how the costs of that delay accumulate. The top line tracks physical functionality, which declines gradually, almost unnoticeably, before plummeting off a cliff. The bottom line tracks medical costs. They remain flat right up until the moment of injury, at which point they spike vertically to pay for acute medical intervention. Waiting for an injury to announce itself guarantees maximum disruption to your daily routine and demands the highest financial cost to fix. There is a mathematical and physical alternative. By adopting the proactive pathway, we shift our focus from treating the injury to maintaining the system. The core premise of this approach relies on a simple biological fact. The human body is inherently a self-healing organism. To keep this self-healing process active, we must prevent daily stress from becoming permanent structural damage. This is where maintenance chiropractic therapy serves as a proactive intervention. This abstract model of the spine illustrates the mechanism. As red micro-stress markers accumulate from daily activities, regular adjustments intercept them. A descending wave systematically clears away the tension, resetting the tissue back to a healthy baseline before those microtraumas compound into a major tear. We don't have to let the structure break before we take advantage of the body's natural ability to repair itself. Sustaining this level of biological efficiency requires a specific daily routine, driven by what are known as the 5 factors of health. The first 2 foundational inputs are proper rest and proper exercise. Proper rest gives inflamed tissues the necessary time to recover from the day's stress, while proper exercise builds and strengthens the stabilizing muscles that hold the skeleton together. The next 2 inputs fuel and regulate the system: proper nutrition to provide the chemical building blocks for cellular repair, and stress relief to actively reduce the physical tension caused by psychological strain. This interconnected diagram reveals how they all tie together, with the 5th factor acting as the central keystone: a properly aligned spine. When in proper alignment, it clears communication pathways between the nervous and musculoskeletal systems, allowing the other 4 factors to synchronize effectively. Optimum physical health is achieved only when all 5 of these factors are active and interlocked in your daily routine. Look at this side-by-side comparison. The bottom red path represents the biological debt of the reactive approach, repeatedly dipping into deep valleys of pain and downtime. The top green path represents the proactive approach, a steady climb maintained by routine care that bypasses those depths. It generates a continuous daily dividend of increased energy and ongoing elimination of toxins. Contrast that uninterrupted momentum with the reactive path, where progress halts completely, forcing you to place your life on hold. Treating the root cause of structural stress on a daily basis is mathematically and biologically superior to treating severe symptoms after the damage is done. Protection from sickness and injury is an ongoing daily routine, rather than an isolated medical event. Investing small, consistent amounts of time in daily preventative care keeps you out of the doctor's office, preventing massive losses of time and money. This deep awareness of your body's mechanics is what we call knowledge of self, the most important lesson for long-term well-being. True wellness comes from actively architecting a resilient, self-healing life rather than simply reacting to damage